Hi, I'm Dr. Safala from Safala Hospital in Mumbai. I'm the Lasik or the laser eye surgery counselor here, and I get a lot of questions related to Lasik or laser eye procedures. What are the differences between them and which is the most suitable for me? I would like to first tell all the terminologies that you all come across. One is Lasik, then there is femto or bladeless Lasik, there is contura, there is wavelight plus or Innovize. We also have relax smile or silk, and we have surface ablations or epi-LASIK. Whenever you use the word LASIK, know this that it has what we call as a corneal flap. The laser is done on that part of your eye where one sticks the contact lens. Typically the colored area, it's a transparent area on which the laser is applied. Now, to make it painless, the requirement of a flap is very essential. So, a flap is created prior to applying the laser which removes your spectacle powers. This flap is either created by use of a microkeratome which docks on the surface of the eye, or it is created with the help of a laser called the femtosecond laser. In Safala Hospital, we have one of the best femtosecond lasers called the Zeiss Visumax. So, when we do bladeless LASIK or femto LASIK, it involves two lasers. The first laser to actually create the flap and the second laser to zap off your number. Now, contura and wavelight plus fit into this second laser. It is the data that the doctor has collected in your outpatient visit during your checkup and your evaluation, which is then fed into the laser machine, and then comes the output. So when we use a topography based data, that procedure is when you use the contura equipment. When you use ray tracing method, which uses AI, that is when you use the Innovize or the Wavelight Plus procedure. But both contura and Wavelight Plus are names of these brands. They are not names of a certain laser surgical procedure. It is the name of the brand or the technology by this company, Wavelight or Alcon, and it falls under LASIK. It falls under femto LASIK. Flaps are a very essential part of LASIK, and the purpose of the flap is one, to make it pain-free, and two, allow a very predictable, comfortable recovery and healing. Your bounce back on your work becomes very quick, almost the next day. So when you make a flap with a femto laser, which means that you are using a laser technology to make this flap, it is more precise, it is more predictable, and it is pain-free when you're during the procedure. Therefore, femto LASIK or bladeless LASIK is the most advanced way of doing LASIK today. Coming to relax smile and silk. So relax smile was a procedure which was introduced by Zeiss, again this company. So the patent of relax is with Zeiss, which cannot be used by other laser companies, hence the difference is called silk. Now these come under the category called K-lex. K stands for cornea in Latin, and lex is a lenticular extraction. So whenever someone asks about smile, which is also called relax smile or silk, it involves removal of the corneal tissue in the form of a piece of corneal tissue called the lenticule. So LEX standing for lenticular extraction. Relax smile came about to make the flap obsolete. It does not mean that there is no incision on your cornea. There is an incision, but it is small. Therefore, smile meaning small incision, lenticular extraction. Now, the only difference between smile and LASIK is that smile, what we find in Safala Hospital, recovery takes a little longer when it comes to visual recovery. The physical recovery of symptoms is almost as close to LASIK, in fact maybe quicker, but how much quicker? It's just a day that you require to bounce back on your feet. However, the visual recovery, we have seen our patients take a little longer for relax smile. Is for those patients where a flap cannot be taken, or it is unsafe to take a flap. The downside of Relax Smile is it cannot be repeated. For some reason, if a small power or a refractive error comes back into your life a couple of years later, the flap created by the femtosecond laser with the help of tools. Mind you, it is not so easy to get the flap out. Mind you, it is not so easy to lift the flap. However, this scares the people because they think, oh, there's a flap and the flap can get dislocated. Till date, over the last close to 30 years of LASIK that we have done, we have never seen a single flap dislocation. It is not so easy for flaps to get dislocated. But this fear makes people lean towards Relax Smile and surface ablation, which take much longer for healing. Now, if you're not fit for any of these lasers, the reasons being, one, you have really high powers. We see patients with powers even high as in their late 10s, like 15, 16, 20. We see patients with really high powers sometimes. It's not common, but those with high powers over 10, 12, 14, 18, even in 20s cannot undergo a laser procedure. It's not safe for them. So for these people, the solution is an ICL or an implantable contact lens. So know this, that if you are seeking getting rid of your glasses or your contact lenses and you want a solution freedom from glasses and lenses, then there is something which will fit you from this entire armamentarium of different types of laser procedures. Which solution is suitable for you comes from a really detailed, thorough examination. Our center at Shroff-I Mumbai, Dr. Anand Shroff is our LASIK surgeon who personally checks your evaluation. He does the tests which are related to LASIK. He does the number checks himself. So with all the tests that he does, he also has Wavelight Plus or Contura data, and having been the first LASIK surgeon to use the Wavelight platform and having used the Wavelight platform for close to 30 years, has the vast experience of knowing which laser procedure is best suited for you and customizing it for your eyes. If you still have any questions related to any of these laser procedures, feel free to call me on this number 98211 drop me a WhatsApp and I'll be happy to answer any of your questions.